Perioperative assessment is one of the most critical yet fragmented parts of the surgical care. As anesthesiologists, we routinely synthesize many laboratory findings. We do airway evaluation. We actually see the comorbidities of the patient, optimization status, and see the surgical urgency under time pressure. Despite advances in healthcare, most existing systems remain either generic chatbots or documentation assistant rather than clinically focused perioperative intelligence system. As anesthesiologist, I wanted to explore whether AI could function as a practical perioperative co-pilot. So here I found this platform where I have developed my own agent. So here I want to show regarding my workspace hub in PromptOpinion, where I have created my agents. So as you can see here, there are patients available to me that I will click on Mahesh Singh and I will activate my AEGIS Perioperative Copilot. So this Copilot has its inherent ability. Let's see the inherent capabilities which it can do. So I will just ask what is the name, age and procedure for which this patient is posted. So let's see what is the reply we get. So in the meanwhile, I also want to show the tool calls which this agent will be calling. Since I have connected it to MCP, which is running on my local hub. So here you can see the calls are being received via my ngrok. Here is the link which is connected to the portal. And here, as you can see, it is developed via coding. So this is the line of code which I have used here. And also you can see it is getting fetch patient from FHIR records. Then it is computing the risk score. And then it is fetching the guidelines. It is not just providing me as it is providing me via guidelines. And also you can see it is generating a report. And thereafter, it is telling me the report in this format. So it provides me that the general report of Mahesh Singh is, it is a 68-year-old male posted for elective hip replacement. Cancellation risk is 56% in this patient because the patient is in heart failure. The RCRI risk is although low. The patient has a stop bank score of 2 by 8 and because of age and male sex. Then it has calculated the FL score, which is moderate PONV in 39% in this case. It has also estimated the AHA, that is class 4 severe systemic disease. And also it is flagging few of the investigations which is required and it is not documented. And it is bagging with the guideline support. So it is suggesting me that according to these guidelines, the patient isn't compensated CHF, the ejection fraction is less and also it requires that the patient should be optimized before surgery. So you can see this is such a beautiful report it has generated to me. And now I'll apply the same to a different patients. So let's test for Ramesh Kumar. So I will again call my AEGIS Perioperative Copilot and I will ask the same question. Assess for preoperative assessment of this case. So let's see what the response it is providing me. Again, I will show you the tool calls which is being activated here. So as you can see, the tools are being received here. It is computing the risk score. So this patient, as you can see, has few comorbidities. It is generating all the things. Then it is responding to me. And it is also fetching the guidelines. It is not just providing me the fluff. It is through proper guidelines. And it is now formatting the report to me. So let's see what is the report being generated to me. It suggests that it is posted for laparoscopic cholecystectomy. Patient is ASA class 3. He needs to be optimized since there are few risk factors which it has identified. So it has a very high OSA risk because of tiredness, known OSA diagnosis. It must have fetched through the PAC reports. Then FL score is moderate here and ASA classification 3. So it is asking to hold medication and then collecting missing reports and also supporting via guidelines. So according to these guidelines, it is asking to hold for metformin, look for these things and also safety reviewer addendum. There's few investigations are missing. It needs to be appended here. So I want to show one more thing here, that how the system is working. So I have provided it with the patient records and also as you can see, it is my own agent. As you can see here, it is AEGIS Perioperative Copilot which is working in the background. So here you can see the system prompt. I provided it with the prompt system. It is a very long prompt and also consult prompt is being given here. The beauty of this tool is it is working on the tools, which is the MCP tool, right? So MCP tool, it is written via codes. As you can see here, there are multiple lines of code and also since it is going through that, now my local server is being provided via ngrok to the system. So it is providing me a very detailed response. So this is how this Copilot is working in the background. So this is my Copilot. So you can also have a look. It has 10 skills. It has airway prediction, evidence-based guidelines, FHIR data extraction, live provision of assessment, perioperative risk statement, data handling and report generation. Also it is an extension via MCP and technical specs are being provided here. So do give it a try and let me know in the comment section.